Did your cat suspect that you are no longer 18 years old, and the mirror suggests that the cat is right? Let's be curious about others' problem solving. In this video, we'll discuss a new facelifting method that's gaining popularity and offers improved results compared to previous ones. We'll meet a doctor who successfully performs these operations in Antalya, Turkey. Medicine in Turkey. Subscribe and ask questions in the comments section. Even if we take care of our health, years will take their toll and will not allow any of us to stay forever young. Unfortunately, the skin will lose its freshness, resulting in additional wrinkles, sagging, and potentially bags under the eyes and a double chin. Doctors' improved appearance. Now, people in their 30s, 40s, and 60s can look different from how they would have looked a century ago. And yet the traces of plastic surgery are noticeable. Tautness of the skin, not very natural facial features. Normally, it is easy to detect if someone has undergone plastic surgery. However, advancements in the field are constantly being made. Over time, new methods and techniques are continuously emerging that offer increasingly improved results. The involvement of doctors in procedures becomes less apparent. One of the newly introduced techniques is the deep plane facelift, which is a profound and planar facelift procedure. This technique allows you to achieve a natural rejuvenation of the face and neck, and rehabilitation is easier than with previous methods. Deep plane, dip plane. In this method is called the space between the superficial tissues of the face and the internal mimetic muscles. The new method affects them. This allows you to better tighten, strengthen, and outline the contours of the face. The deep plane facelift is gentler on tissues, reducing pain, swelling, and bruising after the procedure for a more comfortable recovery. Dr. Sizgan Kurt performs operations using the new methodology in his Antalya clinic. He graduated from Ankara University and received a bachelor's degree in medicine from Erzurum University. Worked in several cities. 4 years taught at the Caucasus University in the city of Kars. Together with his wife, he is raising 3 children. Dr. Kurt met with us to tell us about the new method. In the deep plane facelift procedure, after we lift the skin of the face, there is a lubricating layer. This is one of the layers of soft tissues that are situated beneath the muscles. Deep plane facelift refers to the procedure of going down to the deepest layers and lifting them up. You need to be very careful not to touch the nerve fibers. The complexity of deep plane facelift is precisely in this. You cannot damage the nerve cells that are located in this layer. You need to work very carefully. So, we gently remove the lubricant layer. As a result, the face becomes more beautiful, expressive, and toned. The duration of the effect is much longer. Other procedures have a shorter effect. Can you please tell me the stages of the deep plane facelifting operation? Provide a thorough step-by-step description of the procedures performed by the doctor and their assistants on the patient. With the aid of scissors, we make a precise incision to lift the facial skin. Afterward, we proceed to lift the layer of grease, ensuring a thorough procedure. For this, we use smaller scissors. Then, using specialized instruments, we locate the nerves. With the help of tweezers, we gently lift the layer of grease and securely stitch it using surgical threads. Next, we tighten the upper facial tissues, trim excess skin using scissors, carefully sew the skin and subcutaneous layers together, and skillfully complete the operation successfully. Doctor, please show me where the stitches will be after the surgery. What will they look like? Or will they not be visible at all? Can I write in the fog? If we perform a deep plane facelift from the temporal area to the inner ear, curving around the tragus, continuing behind the ear, and ending in the hairy part of the occipital area, only 2 small stitches will be visible on the facial part. This is from above the ear and below. There is also an alternative option, to make an incision in the temporal hairy part of the head and also go through the ear, ultimately ending in the hairy part of the occipital region. The third option is the temporary lifting. The incision is made in the hairy part of the temple and the stitch is not visible. If we opt for a mini facelift, there will be just a single scar in close proximity to the earlobe. The scars are almost invisible. In the first 3 months, it happens that a scar is visible due to the fact that the wound is healing and reddening. But after a year, the visibility of scars decreases significantly. The dip plane facelift method is relatively new, but it has already proven itself well. The main emphasis is not solely on tightening and removing excess skin, but primarily on the release and movement of muscles and fat layers within the body. At the same time, it is not necessary that every patient should resort to this method. It is quite possible that other facelifting techniques, which plastic surgeons have long been familiar with, may be more suitable. First, you need to assess the situation. In each case, the approach is individual. The type of lifting that needs to be performed on the patient is mainly determined by the doctor. During the consultation, we discuss and advise the patient on the necessary procedure and determine the appropriate operation to perform based on our discussion. There are also certain criteria to consider. If the face exhibits excessive droopiness or heaviness, our recommendation would be a deep lift, deep plane facelift procedure. But if the patient's face is not too saggy, the wrinkles are not too visible, and he is young, then we perform the usual lifting procedure. In certain cases, we opt for a light and temporary lift, which proves to be adequate if the patient lacks noticeable folds and sagging in the treated area. During the temporary removal, the patient's scar is hardly noticeable. We also elevate our gaze. This is another benefit. Even if the patient is still residing in their country of origin, through the use of pictures and virtual consultations, we can ascertain, with a 90% level of accuracy, the required procedure. In 90–95% of cases, everything is planned during the preliminary communication with the patient and obtaining photographs. By the time the patient arrives, everything is usually already decided. People find it convenient to travel to Turkey for plastic surgeries, also because everything takes place here away from the watchful eyes of family members and friends. No one will be bothered by a person's appearance in the first few days after the procedure, no explanations required. You are recovering peacefully after treatment and enjoying the surrounding beauty in a pleasant Mediterranean climate. Doctors promise that if there are no complications, the recovery after deep plane facelift will take a very short time, most of which can be considered more as rest under the supervision of a doctor than a rehabilitation period. After the operation, the patient is transferred to the ward where he stays for 1–2 days. Dressings are being done. After improving the patient's condition, they are discharged on the second day or after 2 days. After discharge, the patient is informed when he needs to come for a follow-up visit to the doctor for a bandage change. By dressing wounds, we can check if everything goes as planned. Patient is usually discharged on day 2. Rehabilitation period lasts for 1–2 days. After being discharged, the patient goes home on the 10th to 12th day. Are more Turkish individuals or people from foreign countries coming to your clinic for this particular procedure? From which countries do you receive the most foreign guests? Our clinic is frequented by both local residents and individuals from other countries around the world. You can say 50–50. 50% are local citizens, the remaining 50% are foreigners. Foreigners mostly come to our clinic from England, Germany, and Russia. Patients from England are the most frequent visitors. What do you believe is the reason behind the preference of many foreigners to undergo plastic surgery in Turkey rather than in their own countries? There are several reasons for this. One of them is an economic reason. Turkey is very advantageous compared to other European countries. The second is surgical outcomes. Here the quality of care is significantly higher, and the patients are much more satisfied with the results following the procedure. The video description includes the cost of the procedure along with the reception, airport pickup, hotel accommodation, and assistance of a language-speaking assistant. Turkey distinguishes itself from other countries by adopting a comprehensive approach to patient care, wherein each procedure must be paid for individually. The company Healthy Turkiye, which works only with verified specialists in both medicine and hospitality, is responsible for organizing such an all-inclusive trip and coordinates all their work for each patient. Healthy Turkiye takes care of everything, from consultation agreements with the clinic and doctor to transfer, accommodation, immigration formalities, and translation of medical documents, and even rest between doctor's appointments. The company's website address is on the screen. There is a lot of information about other directions of health tourism. You can use it as a reference material. Feel free to contact this number for consultation. Don't forget to subscribe to our channel and don't miss new videos about medical tourism in Turkey.